So for this exercise, this is going to be dumbbell carries. So for the indication for this exercise in rehab is going to be for shoulder strengthening as well as shoulder stability. So we're going to be more so in the strengthening phase of rehab. The prescription for this exercise, it depends really. In the past, I've used it just as laps. So down and back is 1 lap, and I've just had the athlete or patient start out just doing 3 laps down and back. And the progression of this exercise can be dependent on what you're trying to do. So you can either use dumbbells or kettlebells, and you can either increase or decrease the weight. I'll get back to the decrease once I get to regression. But for progression, you're wanting to increase the weight if the athlete is able to complete the parameters that you've given them with ease, or they're not reporting anything. You can also put them in different positions for this exercise. So in this example, the patient's in 90 degrees of abduction. So you can also put them in scaption, or you could put them in 90 degrees of shoulder flexion. And that can make it difficult depending on what muscle groups you're trying to strengthen. You could also add a band if they're using a kettlebell to increase that shoulder stability component. And again, this would just be wanting to increase the weight if the patient is able to complete the exercise, or you're at a point in rehab where you want to add challenges to increase shoulder stability. Regression is going to occur if the athlete or patient is not able to complete the parameters given, if they report any symptoms that are related to the pathology that they have, or any pain with the movement or the exercise, or they're just not able to keep their shoulder at a 90-degree angle. That would call for maybe wanting to step back and do a different exercise. So when to discontinue or progress this exercise. When to discontinue would be falling along the lines of regression, as well as if the athlete is moving on to a different phase of rehab, if they're moving more towards plyometrics or anything that moves past the strengthening phase of rehab. And then to progress kind of goes into the progression where you can add challenges such as stability, using a kettlebell and a band to just increase that shoulder stability, and you can put them in that different, with that kettlebell and band, you can put them in scaption or flexion to help with shoulder stability as well. So when you're explaining this exercise to the patient or the athlete, it's going to be important to tell them to brace their core as they begin to move. And then you also want to explain to them to prime or set their shoulders, and that just means pulling their shoulder blades down and back, just to get that initial shoulder stabilization to be able to complete the movement. And when you are instructing them on how to hold the dumbbell or the kettlebell, you want to make sure that they, when they're going to that 90-90 position, that their elbow doesn't drop, whether they're in the abduction, scaption, or the shoulder flexion. So it's just going to be important to explain to them that they want to maintain that 90 degrees of shoulder abduction, or whatever motion you have them in. And this is just an example of that exercise right here.